My name is Julie, and I'll be presenting this information sheet on health anxiety, which has been developed in the Wellbeing service in the south of Glasgow. Here at Wellbeing, we understand that some people may experience more worries about their own and the health of their loved ones as a result of the COVID-19 pandemic. This is a normal and understandable response to a challenging and uncertain situation. Or you may have worried about your health before COVID-19. Either way, you might find the information in this sheet to be helpful. So what is health anxiety? This is a type of anxiety disorder and refers to the experience of believing there might be something wrong with your health. It is normal to worry about our health and about contracting an illness in general. To some extent, worrying about our health can be helpful to ensure we engage in healthy behaviours and look after ourselves. For example, limiting our alcohol intake, exercising, and washing our hands according to official guidelines. This becomes a problem if worries are excessive, out of proportion with the likelihood of having a serious medical condition, and persist despite no evidence to suggest something is seriously wrong. Worries can also be accompanied by behaviours such as seeking reassurance from others, checking our bodies, or avoiding certain situations. So how does health anxiety affect us? This affects our thoughts, feelings, body, and behaviours. In terms of our thoughts, people with health anxiety tend to worry and have negative, unhelpful thoughts and images in their mind about their symptoms or health-related information. They might also engage in a range of unhelpful thinking styles, such as jumping to conclusions. If my doctor doesn't know, it must be really serious. They might also be catastrophizing. It could leave me in a wheelchair. Some people also have all or nothing thinking styles. Unless I'm completely healthy, I must be seriously ill. And finally, some people use emotional reasoning. Because they feel something is wrong, it must be true. It's common that people who suffer from health anxiety spend a lot of time mentally scanning their body for any changes or symptoms as a way of protecting themselves. This is because our attention can be affected if we worry about our health. However, this means that they're more likely to notice any changes, no matter how small. If you tend to worry about your health, these might then be interpreted as a sign of illness. There's certain behaviours we also see in people who suffer with health anxiety. For example, some people will often seek reassurance. And this is a normal, understandable response to health worries, to seek reassurance from GP, family and friends. And this can keep us healthy if it's done according to medical guidelines. However, seeking reassurance can become problematic if you have worries around your health. This is because short-term reassurance gives a sense of relief and anxiety, and you might also feel more in control, which in turn make you worry less. However, because we cannot rule out all health problems, the relief does not last for long and the worries return. People who suffer from health anxiety may therefore get into a vicious cycle of frequently seeking reassurance from others. This in turn might keep their worries in their mind and keep them going long term. If people worry about their health, they might also check their body very frequently. People who suffer from health anxiety will often spend much of their time checking their body for signs and symptoms. However, the more they check, the more likely that it is they will experience any sensations or come across any bumps. Similar to reassurance, checking ourselves can also become a vicious cycle if this is done too frequently and not according to clinical guidelines. Sometimes avoiding situations can make us feel better. However, this is a short-term strategy. We know that long-term, avoiding things can keep our difficulties going because we do not learn that we're able to cope and that nothing bad will happen. When we become anxious, our body's alarm system, also called the fight, flight and freeze response, is triggered. This system is designed to protect us when we're faced with an immediate physical danger, such as a snake or bear. However, this system can be triggered and we can misinterpret things which are not actually a real danger to us, not a real threat. For example, thoughts. It is such thoughts that can lead to feelings of anxiety. The fight and flight response is accompanied by a number of physical symptoms. We might start to breathe faster and our muscles might start to tense up. And sometimes we also experience hands and feet shaking and trembling. So what can I do about it? Cognitive behavioral therapy, also known as CBT, is a skills-based type of therapy which can be used to help you learn how to manage the symptoms of health anxiety. CBT works by looking at the way we think, the way we feel in our body, how we behave, and our feelings or emotions. For example, by challenging our worrying thoughts and reducing our checking behaviors. This is what we call the CBT vicious cycle. If you go onto our Wellbeing website, you can find further information on CBT. Remember when I mentioned the fight and flight system before? When this is triggered, relaxation can be an effective way of calming ourselves and managing our anxiety. For example, through diaphragmatic breathing. You can try placing yourself in a comfortable position in a quiet place and focus on slowing down your breathing. You can also work with your thoughts by challenging them, by looking at the accuracy and see whether or not you can develop a more realistic thought. You can do this by finding evidence for and against your thoughts. On our website, you can find more information on how to do this. Sometimes focusing our attention on symptoms in our body can make us feel more anxious. So you might find it helpful to try and focus your attention outwards. For example, by describing your surroundings or using the 5, 4, 3, 2, 1 coping technique. There are also different ways in which we can work with our reassurance and checking behaviors. And you might find it helpful to gradually reduce the amount of time you spend checking and seeking reassurance until this is done according to the advice of your GP or medical guidelines such as the NHS. Or you may find it helpful to evaluate how helpful it is to continue with a behavior. Please see our health anxiety course on our website for more information on working with these behaviors. If you find that you are experiencing difficulties keeping yourself safe and you're having suicidal thoughts, discuss these with the loved ones or call the Samaritans on 116 123 or access your GP or crisis service or NHS on 111. There's also a lot of other useful websites out there that you might find helpful in learning how to deal with your health anxiety.